Been over a year since COVID-19 landed on our shores, and there's still a lot to learn. A recent study by Epicentre looked into how many people used healthcare services and the costs associated with it. It also conducted a seroprevalence survey, which sought to find out what percentage of the population has developed antibodies against the virus. Well, let's chat some more about it now with Epicentre CEO Cherie Kaywood. She can explain all the fancy, complicated terminology to us. Cherie, a very good morning to you. So tell us about the survey. What were you actually looking for?
The survey has been conducted with the NICD and various other partners. And what we're conducting is a household survey in 3 different locations: in Edendale in Pietermaritzburg, in Mitchell's Plain in Cape Town, and also in Klerksdorp. And this really is linked to NICD's existing respiratory surveillance systems. So what we were looking for is how many people have already been infected and have COVID antibodies. We were also looking at their household, their utilization of the healthcare services, and also really what was the impact of COVID on them from a financial perspective.
Why these particular communities? Why these particular areas?
That was really selected by NICD because they've already been studying these communities for quite some time. But it still does give us a really good understanding of what's happening with COVID in the Western Cape, Durban, or should we say KZN, and also Northwest. So they're very important findings, and they can also then compare them to the existing study data that they have from these areas.
Well, I suppose out of all of this, Cherie, most people would be interested in the whole story with antibodies and finding out how many people have developed antibodies against COVID. How did you actually determine that with the survey?
What we did is that the study design, as I mentioned earlier, is a household study. So they randomly selected points within these communities. We then went and knocked on the door and invited these people to really open their hearts and their doors to us and to these scientists so that we can have a better understanding of this pandemic. We then did a survey with them, a brief survey, and we drew blood from a sample of the households. And these are the findings that we wish to share with you today.
All right.
Is really what was the prevalence that we found within the initial. We've been in the field for about 3 months, and the findings that we're giving you now are really the findings from the first month of the survey. We should be completed the survey in the next few weeks, and then we'll obviously have a comprehensive report. Absolutely. But we believe in sharing information as we go along.
All right, so do share with us what it is you have found and things that would interest, I suppose, the rest of the country in terms, I suppose, mostly COVID is our obsession at the moment.
Yes, I think all of our obsessions. I think it's decimated our economy, it's changed our lives, and I think it's a lot of people, and a lot of the people that did participate wanted their results of their COVID antibodies. So what we found is that from the period in January, or should I say in November, going through to January, because we started in November, we found that the first wave was definitely milder than the second wave, and the second wave was really severe. And at the end of January, according to our findings, about 1 in 3 people had already contracted COVID and had COVID antibodies.
So were there any specifics about this? Were there any particular age groups where you noticed that antibodies, or was it race groups, or whether it was male, female, where you found that more people had developed antibodies?
And I think that's really an interesting question, because a lot of the initial research led us to believe that older people were more likely to contract COVID than younger people. But we found the prevalence was the same across all age groups. So our study included babies all the way up to, there was no age limitation. So we asked participants from babies all the way to older people, and the prevalence was pretty much the same across all. So it doesn't appear as if COVID is really targeting any particular age group. It really is the same across all age groups. And I think that's why it's so important that people participate in surveys of this nature. And we're not finished the survey yet, so we're still knocking on doors and asking people to participate, because we really need the science to understand what this really new pandemic. So I want to thank the people and encourage others that haven't yet participated. If we come to your door, we'll be wearing branded uniforms and branded cars, and we'll have IDs. Is really open your hearts and open your doors and help us beat this pandemic together.
And what do you do with this information, Sheree? I understand you have a couple of weeks more to go. By that time, you know, the third wave would be probably on our doorsteps. I'm hoping not, but those are the predictions. But what do you do with this information, and how can it help us deal with the third wave?
As I mentioned, the partners in the study, we are doing the data collection.
Yeah.
And the principal research is the National Institute of Communicable Diseases.
Yeah.
And they really use this information to inform policy, inform planning. So and would really inform what's happening with these different waves. That's the one thing. But the other thing is that people consent, and when they participate to the survey, for the researchers to run additional analysis on the samples we collect. And that will really help answer so many of these questions. Why some people get this disease incredibly badly and others have it very mildly. So it's really an opportunity to help us beat this pandemic with science.
Okay, the other thing you were looking at here was healthcare services and costs and what people were doing with that or not doing. So just a very quick idea of what you found there.
We haven't analysed that component yet.
Okay.
So remember, we're still in the field at the moment. And really the initial preliminary report, which can be found on NICD's website, is really to look at prevalence and which age groups were more impacted. What we also had as a component of the survey is an HIV component. So we're also testing for HIV and viral load. And the initial findings, and they really are initial, so we cannot say that they're conclusive at all, is that it looks like our HIV prevalence has increased slightly within those communities as well. Right. So everyone's going to have to really wait until the final report comes out for more of that analysis, which would probably be sometime in May or June.
All right, well, that's very worrying indeed. But Sheree, we hope to catch up with you maybe at that point. We'll put it in our diary and catch up with you when all of this is done, when the survey is completed, and see what it is you found and what needs to be done.